Welcome to Food Shrinks.
Hey gang, it's Molly. I'm here with our announcement. Like, if you listen to Food Drinks, you probably know what I'm about to say, but have you acted on it? That's the question. Friends, we just need your help. So, if you're watching us on YouTube or you're listening, can you just take 25 seconds to subscribe to let us know you're listening? And if you're feeling abundant in your giving today, can you rate and review whatever venture you're listening or watching on? And for the extra, I don't know, cherry sugar free, so that's fine, right? Cherry on top, would you send this to somebody? Spread the word. We would so appreciate it. So, what are we talking about today, besties? Other than the fact that I didn't wash my hair and thought I was going to. So if you're watching on YouTube, this is not the look that I was intending, but with my friends, this
We
is
take everybody as they come, exactly as they are.
We're
There's
meeting Molly
no
oh,
judgment-free zone
today.
here.
just healed so many of my childhood. My grandfather's turning in his grave, being like, "No, look, he doesn't look the part today. See, this is why we have friends. Like, thank you. I'm loved and accepted exactly as I am. That will be my mantra for today.
So I would love to talk about, because this comes up a lot in sweet sobriety, is the difference between like knowing better and doing better. So I know something, but I am not doing it. And so what I often hear is like, oh, I'm lazy, all of these other stories,
Ugh.
right? But I would say, like, you hear that commonly, right? Oh, if you know better, you'll do better. And that's just not true. I know I should floss my teeth every night. Do I do it? Nah, nah, nah. There's lots of reasons. My gums bleed. It hurts. I have a hard time being patient. I just want to go to bed, really exploring that. But that's only come with compassion versus, oh, I just don't floss my teeth because I'm a bad person. So I think it is really important today if we can discover like what is that all about when I'm somebody who knows what I need to do, but I can't do it.
Hmm. Wait, I know we're not here to be like therapists, but like, do you guys know the data on compliance?
No.
It's wild. Like, I wish I had the worksheet in front of me, but like, there's this one data study about glaucoma. So, glaucoma is a disease where you lose your vision. Okay. So, one would think every single person who gets a prescription and gets directions on how to not go blind will obviously follow through with this prescription. There is something like only one half of people, like I'll put it in the show notes, right? But like only
Hmm.
one half, or maybe it's only three-quarters of people actually go get help for their glaucoma. And then maybe of them, one half of people follow through with it, even knowing that they're going to go blind. There's something like one half of pediatric prescriptions are filled, like are picked up. I mean, the data on compliance is so wild. And it really does feed in so deeply to, I mean, how hooked we can get into diet culture, how hooked we can get into self-hate, how hooked we can get into not enoughness, because obviously, I mean, like same here, right? I'm like, I can't just make my bed. I can't just work out. I can't just, like, at least I can speak for myself. Like, we're gonna sit here and give you like valuable advice, but like, please know. So Clarissa's saying about her teeth, like, yeah, totally. But the truth is that people just aren't that compliant, right? We're defiant. We have other ideas. We get really, really scared sometimes. And it's funny, like if we focus more on what we were doing and less on what we weren't doing, it
Mm.
might be a really different place to live, you know? What do you think, MP?
Yeah, I mean, I'm with the both of you. I think that we all have very good reasons for doing the things that we do. And personally, I think like 99.999% of the time, it has to do with something about safety, like
Oh,
feeling that nervous system dysregulation, something internally is saying, oh, that doesn't feel right for whatever reason. And it doesn't have to make sense because the part of your brain responsible for that is not the logical critical thinking part of your brain, right? It's the survival part of your brain. And so there's something going on. And I had to giggle a little bit, Clarissa, because I also am a person who does not floss. And like to the point where my dental hygienist just doesn't even ask me anymore. She just knows, like,
Mine
Molly
just
has not
met.
flossed. She's
this
not
is
going to
Molly
floss.
P. She doesn't floss.
She
Yeah.
Yes.
flosses twice a year when I do it for her, is her thought. Right. And like you were saying, for me too, it's a lot of those different things. It's like my gums are gonna bleed, it sucks, like it hurts, I just want to go to sleep. All of those things, for the very same reasons that you said, is why I don't want to put my hands in my own mouth. If I wanted to do that, I would have gone and been a dental hygienist to put hands in mouth. Like, it's not
Oh
something I
my
want
God,
to
I'm
do.
so in love with your feelings on teeth. I feel like we
Right.
learned so much about each other as friends on the show.
Yeah, but I think that it's a really great, just like, example of how it shows up in our lives, that there are many reasons why we don't do those things. And a lot of times it comes back to that nervous system regulation. I'm just ready to get into bed. So then, like, the logical part of my brain would be like, well, then, Molly, start your nighttime routine 5 minutes earlier,
Mhm.
or do it earlier, and that, like, do it after your last meal, and then it would just be done. And then everything in me is like, no,
Nope.
and I couldn't tell you why. And I don't think that we have to explain it. I think it's just the knowing of nope. But what are the other things that I do? I definitely brush my teeth. I definitely use mouthwash. I do floss from time to time when something gets in there and I need to get it out, right? That there are things that I still do. I drink a lot of water, whatever. So, I mean,
Right.
I think, like, when we think about that from that bigger perspective, like you were saying, Molly, if we focused more on what are the things that we do, what are the things that are working for us, what are the things that move us in the direction we want to be going, if we focused on those things, would it feel as big or like problematic?
Well, I don't think I mean, I'll speak like, I think that that's really like an issue of self-trust, right? And so when we're surrounding ourselves with, diet culture, deep, vultures that are like, you're not good enough, you're gonna relapse, like, you're like a heroin addiction addict with the food. Like, I don't know. It probably is going to train my brain to be always scanning for something that's going wrong.
Right.
What I think is really interesting, for me at least, is this, like having some feelings phobia, which I think is like a common thread among all of us humans, all of us addicts. And so a lot of times, when we know we're supposed to be doing something, a lot of times that, and we're not doing it, a lot of times that comes with like an uncomfortable feeling, like, and a really opposite feeling, right? Like, I really want to floss my teeth and I really, really hate flossing my teeth. And at least for me, like, you know what I was thinking about actually when we were talking about this? It's like maybe a little bit more of a comprehensive example, is like many months ago when we were talking about that marketing person that, um, you know, really burned me. But it's sort of like I was having these feelings in that person, in that transaction with her, that were so uncomfortable to me, right? That were like, I don't know if this is the right thing. Like, and it was so aversive to me because I didn't want to get into a fight with her. I wanted to get what I wanted. Somehow my nervous system made her like a threat, or idealized her, right? So what did I do? I shamed myself, I questioned myself, and I refused to look at what was happening. And
Mm-hmm.
Right.
we call this ambivalence. We call this ambivalence. And the problem is, ambivalence is having two opposing ideas. And the thing about ambivalence, in my experience, so dying to hear what you guys have, is that when I'm willing to look into my ambivalence, it's literally all the wisdom. All of my spiritual growth has happened from looking at, and it's that shadow, right? It's looking under, it's looking where the cobwebs are, it's looking where the rats are. It's like just going in there with compassion. I came in
Okay.
on the call, Molly, and I came in on the call today, like Molly and Clarissa, like somehow are always early. That is not my MO. And I hear Clarissa be like, we just need to look at it with compassion. And I'm like, oh my God, right? And so it's like when I'm really and anything in my life that I've made a change, because change only comes from pain.
Yeah.
So any change
Yep.
I've made in my recovery, this thing that happened with this marketing person that changed me on a constitutional level, it changed my appeasement. It made me really have to look very deeply into my appeasement. Um, but I think we have to be open to the idea that ambivalence is not that we're wrong or that we're bad. Actually, like,
Mhm.
very rarely would I say this, like, it's actually the opposite. It's just a little siren to
Right.
look at something
Makes
else.
sense. It
Right.
makes sense. And do you think it's possible to explore ambivalence without compassion?
Well, painfully. I just in such a, painfully. Yeah. So people like, well, I know that it's wrong. Well, I know that I'm scared. It's like, not effectively. I guess you could, but if you want to really understand what the shadow's trying to tell you,
Right.
can't go in with a pitchfork, you got to go in with peaceful hands.
Right. Like a flashlight. Like, let's, yeah,
And a
like,
little
look.
storybook.
Yes, yes. Let's understand and let's like appreciate that you have a very good reason for everything that you're doing and that it makes
I
so much
know.
sense and that that's okay. And maybe if we can be with that and we can like feel it, then maybe we can move through it. I love what you said there about the feelings phobia. I think that it really is such a huge piece is I don't want to feel any of those feelings. I just want to do instead.
And fix and
Yes,
fix.
do and fix.
Yeah.
And where
That's
does that
safer.
come from, though, right? Often it comes from we maybe had big people in our life that were uncomfortable with big feelings. And so we were taught not to have big feelings, or we were given the message that big feelings weren't okay in some kind of way, or they didn't have the ability to help teach us how to navigate and manage them. And so here we are as big people and ourselves, and now we don't know what to do with them either,
Yeah, we're repeating the pattern.
Yep. Yeah, yeah,
We're like integrating the pattern, which is even
yeah.
worse. Wait,
Mhm.
this last weekend, I was at my college. I was going to my college reunion. I mean, this is sort of it, right? So, and I was paralyzed trying to pack.
Mm.
Paralysis. I could cry telling this. Of course, I'm going to cry. It's food drinks. But like I was paralyzed. I was and I'm telling you what you're saying, Molly P, right? All of my trauma from being heavy, all of my trauma from my trauma of college, it was like, you don't know what to wear. You're going to look disgusting. Everyone's going to look better than you, blah, 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 blah. And I did it differently, I just I literally did it as I would prescribe it. I put my hand on my heart. I was like, Mal, it is very scary trying to
Mhm.
get dressed for this. I could cry. I really get why you're scared. I really get why you're scared. This is an old wound. This is an old wound that you look different, that you are different, that you're not going to fit in, that you're not going to have the right clothes like everybody else does, but it's okay. It's okay. And there's a couple outfits we know that works and you'll be okay.
Mhm.
And I packed. And my clothes were not actually weather appropriate, but I did have good clothes there. But I don't know. It's just, I think, I don't know. To me, it's like, this is the work is really learning how to be comfortable with our shadow.
Because
Mhm.
what you did in that moment was feel your feelings rather than run and
Mm.
say, I'm not going. Right.
Mhm.
Or throw chocolate down my throat to anesthetize myself to be able to pack. And
Mhm.
Yeah.
throw it in like in balls, like that's what I used to do. Or I'd be like hungover at 3 o'clock in the morning, packing my suitcase, not being, numbed up and
Yeah.
the shame of the hangover, food or otherwise.
Yeah.
Yeah, this is that piece where like people laugh at me when I like describe myself as a type 2 fun girly, because this is type 2 fun to me. Okay, so the shadow work that you're talking about, Molly, for me, it's about like burning that away, right? And for me, like I look for opportunities to experience ego death as often as I can.
Wait,
And
I want to get on this bandwagon. So
yeah,
can you just like lay it out for us and the listeners of like,
well, sure.
but by
And
the
I
way,
don't,
life is such like spirituality to me is a shift in what you choose to believe. And like,
yes.
in this moment, listener, in this moment right now, I want to explain what's happening. I am just going to buy this. I think it's free, right? This belief you're about to share with us
Yeah, totally.
for free. I am about to buy what Molly is selling. I just want to offer you to come purchase it with me. Okay,
Uh, it's
teach
just
us.
my own belief. So I was a person who ran from like I could tolerate pain, physical pain, emotional pain. I could tolerate it, tolerate it, tolerate it, tolerate it. And what did it get me? It got me, emotional eating. It got me some pretty cool diagnoses on a chart. It got me a lot of things, but not really things that were moving me in the direction that I wanted to be going. And when I started therapy 20 years ago, um it was like, I'm not a person who loves therapy, right? We all have those clients who are like, oh, I love therapy. I love it. I love
I
it. I love it.
do.
Yeah.
I do.
Clarissa does.
I'm like,
I'm
I'm
not.
middle. I'm middle.
There
Yeah.
you go. There you go. Okay. So we've got
Venn
all
diagram.
three, we've got the different aspects here. But the thing for me was, I was like, okay, I know I have to do this to save my life. So if I hate it, I'm certainly not going to get what I need. And I'm never going to be the person who loves it, or at least, I mean, I'm using the word never, and who knows? I don't know what tomorrow may bring. Tomorrow, I might love therapy. But what I could find was that messy middle. And that messy middle said, how can I make this manageable? How can I make this palatable? How can I make this into like, how can I make this work for me? If it's something I have to do anyway, it's going to be painful. How do I make it work for me? And it almost became a game. And it became this, what fresh hell awaits me? What like really hard thing am I going to get? Because that's one of my strengths. I know one of my strengths is crisis management, critical thinking. I can like look at a problem and think outside of the box and come up with solutions, right? So I knew that I had these strengths. And so I just started applying it to my own life. And every time, like I said, like that ego death experience is when I purposely put myself in positions to be humbled.
Say what you mean by humbled.
That I put myself in a position to be in that place of I have to. So like, for example, one of the best things I can think of is like when I go hiking. I am in a big body. I am a slow hiker, but I like getting out there. I like being in nature, all of those things. So in my mind, this is going to be an easy hike because All Trail says it's going to be an easy hike or a moderate hike or whatever it is, right? So I like, that's how I get myself to the trail. But about, I don't know, it takes me a good 20, 30 minutes before the anxiety subsides, but it's that talking myself through it. You're okay. One foot in front of the other. Get to that place. You can see that place up the trail where it flattens out. You can rest there, right? So it's like, it had to become this way of talking to myself that was cheering myself on, but didn't let me get away with turning around and walking back down the trail without finishing. Now, if there was an injury or there was like an animal in the tree, right? If there were real reasons why I couldn't finish, I'm absolutely going to give myself permission to do that. But it's that walking myself through those really difficult situations over and over and over again. And just because I've hiked the same trail 20 times does not mean that I don't still experience the anxiety, the fear, the want to quit, because I do. That is in me.
But what do you do when you're with people on that trail and everyone's like lapping you?
Yep. That's me with Clarissa. And this is what this is.
Oh,
it
I feel
is,
so
it
left
is, and this is
out,
a
but I'll
really,
be
no,
back
no,
there
no, it
with
is.
you. I'm a
It
very
is, but
slow
this
one.
is a beautiful, this was a very beautiful experience for me. Is we were in Iceland chasing waterfalls, and there was this one ginormous waterfall, and you had to climb, like, instead of doing a hike, you had to climb all of these stairs to get to the top. And I told Clarissa, I was like, just go. And I got up, I don't know, I would think I was only like 10 minutes behind you. I mean, I wasn't that far behind you really, right? So I get up there and I'm thinking to myself, and I started videoing for our clients. And the thing that came to me was, listen, Clarissa got here 10 minutes before me, but I still got here. I am still seeing the things she's seeing. I am still reaping the rewards she was receiving. She just got there at a different time than me. It wasn't better. It wasn't worse. It's not good or bad. It just
Is different.
It's just
We
such a
get
great
there
hold on
when we
yourself.
get
It's
there.
really keeping the focus on yourself. You know, it's just like
Yeah.
I find that very hard. I
We
find
can't
not
do the
comparing
comparison thing.
myself
Yes,
really
come
hard.
back and let your ego go. Let it burn away. I'm not saying it's fun. I mean, that's why I'm saying it's type 2 fun, because it feels good on the other side when you can go, look at what I just did. Look at that hard thing I just got through that I really wanted to quit in the middle of. And that's the same with recovery. There have been dark, dark, dark moments in the middle of my recovery where I'm like, you know what? There's a real easy way out of this. And what would that mean for other people? And am I willing to do that for other people? You know what I mean? And so like, for me, when I can let the ego go and say, there's something bigger in this for me, if I
What are
can
we
just keep
defining as
pushing
ego?
through.
Like like the pride, what are you calling ego?
Yeah, the piece that says, like Clarissa was starting, like, I should know how to do this, or I should be doing this. I already know better. If I would just do these things, this thing would be easier for me. Like,
So
all the
invalid. That
shoulds
voice
and
is so
shame.
invalidating. It
But
really,
it's so
Yeah.
that
protective. I
voice
get
makes
why it exists.
that voice makes no assumption that you're trying your best. It feels
Yeah,
really like abusive to me, that
It
voice.
does. It
it is
does.
emotional abuse.
And it's protective, and is it helpful always? I don't know, but
Is it helpful
it's a,
ever?
I don't know, but it's a topic that we can certainly talk about forever and ever. And I don't know, any last thoughts?
Clarissa, yeah, it's like Cliff's just the quiet one today. Got anything?
No, this is because this is like so much what I've needed help with, and I have so many different perspectives and thoughts on it. And it's like for me, it just still comes back to without compassion, this is not possible. And yet, it is the thing that if I'm so stuck in the shoulds, I have a really hard time finding.
Oh,
And I think maybe our next conversation should be about like, how do I start to find compassion if I can't find it? Because I think that's also something that so many clients struggle with, especially, even in this
and by
diagnosis.
clients, you mean me? No,
We all could do it. Well, if you want to hear more on this topic, if you want to tell us what you want to hear, if you have questions, just email us at asktheshrinks@foodshrinks. Thanks for listening to Food Shrinks. Quick reminder, this podcast isn't a substitute for professional medical advice. Always consult your healthcare provider for guidance suited to your needs. If you enjoyed this episode, please like, share, and subscribe to help us reach others on the recovery journey. Take care, and remember, freedom with food is possible. See you next time.